Well, hello, ladies. We meet again, and today is day 2 of Pre-Med 3, week 3. So, what we're going to be going over today are, yesterday we covered aging, and today we're going to be going over medical terminology. Now, learning medical terminology is almost like learning a second language. But what you find out though is the first part of the word is going to give you or tell you usually the body part that's involved. The second part is going to tell you what's going on with that body part, okay? And in Dominican, I had to take Latin and I hated it, but now it kind of comes in handy because most of the medical terms are from either Latin or Greek. All right, let's go over this page right here. All right, it's the handout. And a prefix is a word beginning. Now, these are things that you should have at least heard of, maybe in 3rd or 4th grade. A suffix is a word ending. Now, the root is the foundation of the word, all right? Now, combining vowel is usually an O. And the combining form is when you put the root and the combining vowel together. Like this. Watch, let me show you. Okay, here's the root, dermat. That tells you it's going to be something with the skin, because derma means skin. Now, if I were to just have a /O, this is the root, this is the combining vowel. But watch what happens when I put them together. Look right here. I took the root and the combining vowel, put it together, and it's becoming a combining form. That's what these notes are talking about right here. And I kind of wrote it out because it's a little sometimes awkward to understand. All right, we're going to go through some prefixes, some combining forms with the root word, and suffixes, and what they mean. The first one is hypo. Hypo means below or under, all right? Hypotension, low blood pressure. Hyper is just the opposite. Come on, you ever given a child 3 years old 5 cookies to eat at one time? Then you know what hyper is. It's excessive. Sub is below. Think of a submarine. It goes below the waterline. Neo means new, like we had in our notes. Neonate. Neo is new. Nate refers to birth, born. EX means out. They're going to excise the wound. They're going to cut it all out. Those are prefixes at the beginning of a word. Root words. Now, these are actually the root word right here. Forget that /O. These are the root words, but when we put the /O, it becomes the combining form. So the root is that part. Oh, not bad. And the combining form is when we put the root with the /O. Well, I guess we saw the answers too, huh? Meno refers to menses, which is a woman's menstrual cycle. Ortho, orthopedist, bone. Orthopedist is bone. I'm sorry, yeah, ortho is bone. I'm wrong. Oh, ortho, come on, oh Lord, straighten me out. Straighten, how you like that? It means straight. I don't know where I got that from. Ortho means straight. Some of you may work for an orthodontist. What do? They straighten teeth. So forget the bone, it's straight. Neuro means nerve, all right? You may hear somebody say they have neuropathy. That's a disease. Pathy is disease of the nerves, all right? A lot of diabetics have neuropathy, nerve pain in the feet especially. Osteo, that means bone. Osteo. Remember one of the terms in our notes? Osteoporosis. Osteo is bone. Porous, think of it like a sponge with all those holes and openings in it. That's something that's porous that can go through. Then we have uro, which means urine. Now we're coming to the suffixes or the word endings. Ology is study of. And you can have the study of a lot of things, all right? Ology, dermatology, study of the skin. Let's see, neurology, study of the nerves, all right? That you can put ology. Ology and itis. Itis is not even on here, but it's a good one. Ick means pertaining to. If I were to say they injured their thoracic area, thoraco means chest. Ick means pertaining to. That's the area that was injured. Trophic means growth. A lot of times people will have hypertrophic bone issues where the bones continue to grow. It's not a good thing, all right? Hypertrophic. Hyper means, trophic means growth. Look, we put hyper with trophic, with the root or the prefix with the suffix. Osis means condition of, all right? There's something that can go on with the intestines where little pockets will develop in the actual intestine, and little seeds like cucumber seeds, strawberry little bits can get in there, tomato seeds. Now, when you have the disease, it's called diverticulosis. That's the diagnosis that you're going to get. When it flares up and you're in pain, it's diverticulitis. See how the itis comes in? And finally, we have pathy. And pathy means disease, like neuropathy. All right, on the next page, we have abbreviations and symbols that are highlighted. And we're going to go through these. NPO. Let me show you something. Wait, well, I don't have a board to show you. NPO. Hang on. Okay. NPO in Latin stands for non, meaning nothing or not, per, by way of, and this is OS, non per os. An os is a muscular opening, like your eye, okay? That's an os, your mouth. Because when you think of nothing by mouth, you think it would be NBM, but no, it's NPO. That's where the Latin comes in, non per os, NPO, nothing by mouth. URI is upper respiratory infection. OU is both eyes. I'm going to show you something here. This is me, okay? OS, OD, OU. O is always going to refer to ocular, which is the eye, all right? Now, look at the S. And I want you to notice which way the tail on the S ends. The tail on the S points to the left eye. The OD, now OD can mean a lot of things. You have to put it in perspective. OD, this time we're talking about right eye. Look at the way the D points to the right. And OU, watch this, you're gonna like this one. If you can put a face in it, that's both eyes. Okay? But don't get OD, overdose, mixed with right eye, okay? All right, let's see, we have PO. Well, right here we had non per os. What if we take the non away? Per os means by mouth. You can be able to read prescriptions now. Let's see, then we have TID, 3 times daily. BID, 2 times daily or twice daily. Q, think of quadruplets, 4 times daily. AC is before meals. AC, not air conditioning, it's before meals. Stat, that's a term you want to make sure you learn. Stat means immediately. When I was just a candy striper at Oshner Hospital, it was the nurse and I on the cardiac floor and nobody else. They'd all gone to lunch. And she comes out of her room and she says, "Give me a monitor, Stat." Well, I go in the equipment room and I'm looking at all the monitors. I don't see any of them named Stat. I didn't see a company called Stat. Little did I know, I was only 14. Give me a break, cut me some slack. But I found out Stat means immediately. Now, lowercase GTT or GTTS, lowercase is drop or drops, okay? Let's see, then we're gonna go to OS. Well, we already did that one right here, okay? Left eye. QD, is every day. FUO is fever of unknown or undetermined origin. SOB, don't even go there. It's shortness of breath. NKA is no known allergies. Ladies, this is so important. You've got to ask the patient, do you have any allergies? If they do, write them in red and put it on the front of their chart. Now, what I put next to that, just me, is NKDA, because a lot of doctors are starting to use that because that means no known drug allergies. I mean, if you ask them if they have any allergies and they say they're allergic to grass, how many doctors are going to give somebody an injection of grass? But still, they still use NKA or NKDA. UTI is urinary tract infection, TRACT, not TRACK like a train track. Urinary tract infection. Then we come down to PC. Well, AC was before meals. PC is going to be after meals. QOD. Well, we know QD means every day. Guess what? QOD is every other day. FBS is fasting blood sugar. It's part of a test for diabetes. If any of you are pregnant or have had children, you've had this test done. It's done routinely, along with one of the other tests we're going to get with in just a second. So FBS, fasting blood sugar. HS is hour of sleep, or at bedtime, either one, whichever one you want to use. PRN is as needed or as necessary. LMP, last menstrual period. You're going to ask every female patient you have, when was your last menstrual period? Especially because you're going to be taking x-rays on them. You need to know this. Can't do it in the first trimester at all. So this is a very important question. GTT. Now remember, we had lowercase GTT here, and that was dropped. Here, it's capital GTT. Now remember, I told you that FBS is going to have something else to do with something? Here it is. The whole thing is called glucose tolerance test. And in it, you do a fasting blood sugar. Fasting means you don't eat or drink anything after midnight. You go into the doctor's office early in the morning. They're going to draw your blood just to get a base level as to what your blood sugar level is. Then they're going to have you drink this really sweet kind of stuff. And then they're going to start checking your blood like every half hour, because they want to make sure as your sugar increases, drinking that drink, your insulin also increases to keep it even, all right? Then we have GBS, or it's actually GBS, is gallbladder series. It's a test done to see if you have gallstones. OD is right eye, or overdose. And a CBC is a complete blood count. They're going to count how many red blood cells you have, white blood cells, and platelets. Now, down here, we're getting to symbols, and I'm going to write these in so you can see what they look like. I was trying to explain it. It doesn't work. Okay, let's see. I have it. Okay, with is the C with the line over it. Now, you would think it would be a W slash, right? And when you were a regular private citizen, it was a W slash. But now that you're in the healthcare field, with is a C with a line over it. Where does it come from? Latin. It means Spanish, actually. Con means with, all right? Chili con carne, all right. Without is the S with the line over it. And what it stands for, I'm going to show you, don't laugh. It's not pronounced sin, it's pronounced sign. Well, you want to be without sin, but sign, that's where the S comes from. To me, if you understand where these wacky things may come from, you learn them and remember them better. Okay, past is P with a line over it. Past or after. Now, ounce, watch this one really closely. Ounce is a cursive Z with an extra loop on top. You no longer do the OZ, but I'm going to show you a little way to remember the extra loop. Normally you would write ounce as OZ. Well, think of this little extra loop up here as the O. O, and then you have your Z, ounce. Dram, which is another measurement, we haven't gotten to that yet, we'll do it next mod. Dram is just a regular cursive Z, okay? Those are symbols and abbreviations. All right, let's see. I want to ask you a few of them as well, just to make sure. AC means what? No, it means air conditioning. No, it means before meals. And HS is hour of sleep or bedtime. LMP, all capital letters, last menstrual period. What about OU? Okay, OU is both eyes. Now, let me show you some that are not on here that are really important, all right? I'll show you right here. This right here. C/C or C/O. That's when the patient comes in, you want to get their chief complaint. That's what CC is. CO means they're complaining of, okay? I'm going to show you a few other ones. HX, FX, BX, okay? You're going to find a lot of terms in medical field or healthcare field are one letter and an X. Because you're writing so much, some doctors still do write their notes. HX is abbreviation for history, the patient's history. FX is fracture, like you got a broken bone. BX is a biopsy. Now, if the doctor puts this on the patient's chart, don't get insulted. FU means follow-up. They want you to make a follow-up visit for the patient, all right? Let's see, what else do we have? What's a CBC? A complete blood count. And what is TID? 3 times a day. And PC, not just politically correct, but PC, after meals. All right, I want to ask you a few little questions, and let's see how we do, all right? You can always come back on this and look whenever you need to, all right? What is the study of aging? Remember that in the notes yesterday? The study of aging is gerontology. Gerontology. The inability to control urine, that is urinary incontinence. And remember, I told you there's basically 2 types, stress and urge. Stress is you laugh, you cough, you sneeze, whatever, and you may leak a little bit. Urge is, uh-oh, I didn't realize I had to go to the bathroom. That's how urge works. If your BP is blood pressure, let's get used to that one. If your blood pressure drops when you stand quickly, what do you have? It's orthostatic, ortho meaning straight, so you're standing or sitting, hypotension, your blood pressure drops, all right? What is the age described between children and adult? Anybody remember? I want y'all to look that one up. I'm not giving you all the answers. Come on. Between children and adult. Let's see. Let's find another one. What's another name for fatty tissue? Subcutaneous. Sub means below or under. Cutaneo means skin. So it's subcutaneous. The medical terminology for an enlarged prostate gland. Okay, ladies, we don't have a prostate. Men do. But the abbreviation is capital letters BPH. And what it stands for, it says in the notes, benign. It's not what you're going to be after you ate. Benign means not malignant. Benign prostatic, pertaining to the prostate, hypertrophy. Hyper means excessive, trophy means growth. It tells you what it is in its name. Benign prostatic hypertrophy, okay? And from the age of birth to 1 month is what? It starts with neo. Right, neonate. If your middle-aged patient has had a cessation of her menstrual cycle, you would consider this to be menopause. Why is it guys are always in our stuff? Menopause, menstruation, gynecology. They gotta find something better to do. A weakness of bones is called bone. Beginning of the word, osteoporosis. Okay? Another name for your limbs, your arms and your legs, like trees. They're called extremities. So next time you're outside with your child walking around, you see a tree. Look at all the extremities on the tree. No, don't really do that. As an assistant, what must you always do for the senior adult? Not just medical, but everybody. And it's not just for an assistant. This should be for anybody with a senior citizen. Treat them with dignity and respect. Remember, if it weren't for their generation working their butts off, our generation wouldn't be here or have it as nice as we have. Sometimes you don't think it is, but believe me, it is, okay? So treat them with dignity and respect. Repeat something, okay? If they ask you to, just make sure they understand. And always offer assistance. So you see why I said it's not just a medical assistant or just dental assistant. It's everybody. I mean, hold the door open for somebody. They don't have to be a senior citizen. Hold the door open for them. All right. Urinary incontinence is, right, inability to control urine. At what age does menopause usually occur? Now, it's 45 to 55, but like I said yesterday, ladies, it's not written in stone. I've seen women as young as 38 and 39 come in, and I've seen women as old as 70 come in. It has a lot to do with your heredity. Let's see. What's the average life expectancy in the United States? Oh, about 77.9. Insurance companies do this. They get all these actuary tables and figure this stuff out. I think it's kind of gotten a little bit older by now. Let's see. The pre-adolescent, remember I told you PP? Pre-adolescent stage is also known as puberty. And ladies, these can be the longest years of your life. And yesterday I said about my daughter, boys are a little bit easier, but not that much. They get moody, they don't know why. You ask them what's wrong, I don't know. The best thing you can do at this stage, or any stage of your child's life, keep the lines of communication open. I always told my kids, you can tell me anything. I will not get upset. I will not get angry. And I had to put my money where my mouth was a few times because, they would tell me some things sometimes and I'm like, I didn't do that face. I'm like, oh, uh-huh. When I came out of their room and closed the door, I went, you got to be kidding. But this way, at least we kept the line of communication. Because they would come home, especially my daughter, throw herself on the bed. What's wrong? Nothing. No. Look, and this went on for an hour. 2 heads are better than one. If you tell me what it is, I won't tell anybody, and I won't make fun of it. I want to lose about 10 pounds. Okay, get your shoes on. We're going to the store. And I proved to her that by telling me, we did something about it. We bought healthy food. She lost the weight and looked great in her prom dress. All right, motor skills are referred to as neuromuscular skills. Neuro, nerve, muscular, all right? That's dealing with motor skills. Think of a newborn. They kind of lay around like this, like third base. They just sit there. Eventually, though, they start to be able to hold their head up. It's terrible watching it because the poor babies, their head bounces, all right? And eventually they'll start to sit up. And this is learning how to do their motor skills. Remember, 0 to 1 year, the first year of life, is one of the greatest moments of growth, all right? So I will see you cupcakes tomorrow, and we will go over a review and make sure, I want to make sure, and thank you, Tia, for coming by today and picking up your books, love. And I'm glad Kenya had her books, but she didn't tell me she came and got them yesterday. But that's okay, we're still friends. Listen, make sure you have the virtual library, okay, that word I emailed those words to you. Just pick one of them out. And then the flip cards, that's what they call, because normally they're on a ring with cards. flip cards. There's 25 of them. All you need to do is break them down into syllables. And now that everybody has their textbook, look back in the back in the glossary or in back of the language of medicine book, the softback book, and that will tell you what page it's on. It'll tell you how to break it down, and it will also give you the meaning, all right? So, because I want my cupcakes to learn as much as they can, I want to open your head, pour the information in, and close it up. All right, my loves, I will see you tomorrow. Bye-bye.